My name's Jake Camp. I'm a clinical psychologist and DBT therapist. For today's video, I'm going to be talking a bit about what DBT or Dialectical Behaviour Therapy is. The first thing that I want to say about DBT is that it's an incredibly complex model, so I'm probably not going to be able to do it in full justice right now. But I'm going to try and give you just a sort of brief introduction to some of the sort of core components of it. Particularly, if you're someone who is interested in knowing more about that, but also, if this is something that's been discussed as a possible, option for you and as a sort of therapy or a treatment. DBT was originally developed for people who really struggled with self-harm or were at high risk of suicide. As time's gone on, DBT has really blossomed to sort of be a really viable therapy to treat lots of different difficulties and lots of different populations. What's interesting with DBT is that we very much focus on the treatment of emotion dysregulation, which is, difficulties managing intense emotions. And we think that, that's a mechanism that underpins lots of other different difficulties, which is why DBT can be so useful for many different types of problems. So it's not just limited, albeit to self-harm and suicidal behaviours, albeit self-harm and suicidal behaviours are certainly where the biggest evidence base is at the moment. DBT was made as a sort of multimodal model of treatment, i.e. it has loads of different parts to it and lots of different stages to it. The biggest and most important stage of DBT that you'll hear about is stage 1, which is really a treatment that aims to stabilise or to help people find more stability when, there's a lot of chaos in life, there's a lot of difficulties going on. And if you're being offered DBT in, sort of health services, this is likely the model that you're getting. So I'm going to talk most about this today. The most evidence base sits with stage 1. However, stage 1 now integrates some stage 2 treatments. So, if you're in a stage 1 DBT program, it's very possible that they can offer you stuff, around, say, trauma reprocessing or other stuff like that. So stage 1 DBT. Stage 1 DBT is made up also of multiple parts to it. As I said, it's a really complex treatment. This is important though because so often people come to us and say they've received DBT when in fact they've only received a really little part of what is meant to be offered as part of DBT. So it's important you know what the different parts are and why we offer them. I'll start by saying that, DBT has about 5 different functions. It aims to do about 5 different things. The first one is it aims to increase your capabilities. What that means is it aims to teach you skills to manage life effectively. And the main way we do that is through our skills group component. So that is a group that meets roughly once a week where you're taught different skills of managing emotions, relationships and so forth. So that's one component. The other function, the second one, is to help increase motivation, to use some of those new skills and capabilities. And the main way we achieve that is through individual therapy sessions. So again, you should, alongside your skills group, you should also receive roughly weekly individual therapy sessions as well while in DBT. They really line up really nicely because it really helps you learn the skills in skills group and then try and find a way to implement them and build motivation to use them in individual therapy sessions. The other function is to help you generalise, what you're learning into everyday life. Because of course it's not enough to just learn something in a sort of therapy context and hope that that's just going to automatically, spread into your everyday life. So the main mode of therapy we have for that is what usually is called phone coaching. But, it kind of started off as just phone coaching. It can now be any sort of between session contact with a therapist to help coach you to use skills. Now, this is really important, of course, because this is like having a tips hotline so that when you're struggling or you're going through sort of dilemmas in life, you can have, a sort of tips coach to help you think about how to navigate that effectively and in line with your goals. So they're the first 3 components. So you've got phone coaching, skills group and individual therapy. A part of the treatment that maybe will be less clear to you as a client in DBT is the other function, which is about increasing therapists' motivation and capabilities to treat. So this means that me as a therapist, I should receive sufficient support and scaffolding, to make sure that I can do a pretty good job for you, and that I stay in the job, sort of thing. So the main part of DBT, or mode of DBT, that offers that is something we call DBT Consult Team. And ultimately that means that DBT therapists should always work as a team, and they should meet roughly once a week, with their team and support each other to do the therapy. Almost like therapy for the therapist, sort of thing. And that bit's super important. The final function, there's a lot of them of course, but the final function, and this is also important, is about how we make sure that we structure your environment so that it's more validating and supportive. Now, as DBT therapists, we really try and sort of lean on more consulting to you as a client and really skilling you up. At the same time, we will step in the environment if it's too powerful or if we are particularly needed to as well. So part of the way we do that is through, maybe we work with your networks or with other people involved in your care. Another part of that, depending on what program you're in, is there might be parent or carer or family support as well, which might include them actually being in your skills group with you. It might include sort of sessions where you come all together, maybe called family sessions. But it can be sort of ultimately a lot of different ways that, we bring in your network or bring in your environment, to try and help shape them up to sort of be more skillful and validating for you as well. So this is important because in order to have comprehensive DBT, the most evidence-based version of DBT, really you need to have those 5 modes in there in some way, shape or form. If you are receiving, say, just a skills group or just individual sessions, this of course may be DBT informed, but this is not DBT. And we think that comprehensive DBT is particularly helpful for people with high levels of need because of course, you need the level of support to be proportionate to the amount of need that there is, which is why DBT has so many parts. While it may be sufficient for some with lower levels of need to just get one bit of DBT or DBT-informed work, it's really important that those with high level of needs get offered, those full program, because that's what's most evidence-based and that's what we think works. And we also know that there's sort of emerging evidence that skills only, without other support, for sort of, people who have high levels of need may have a slightly, may not work very well, and actually for some may make things worse a little bit. So really important to think about that and know that, to have DBT you need to have all those parts.